You are now listening to Out of the Blank.
Welcome to another episode of Out of the Blank podcast. I'm here with Dr. Fred Russo.
How's it going? Thanks for having me.
Well, how's your day going, man? I mean, you're obviously outside enjoying it.
Yeah. I just moved to Florida from Washington State, so kind of the other end of the spectrum weather-wise. So it's been pretty nice transition.
You moved to Florida. Okay, aren't you aware that there's gators out in Florida?
I've been told, and I see them everywhere.
I started hearing like a bunch of people from Florida that come down to like my town of like Ocean City, Maryland. They're like, yeah, you could run into, literally, I ran into one on my motorcycle. I was like, what? Like, yeah, it was like a giant speed bump, but it moved. I was like, holy shit.
Oh my God, that's funny.
Well, so what exactly do you do, Dr. Fred Russo?
Yeah, so well, and every state has a different title but basically I do acupuncture and Eastern medicine primarily. So I can talk a little bit about that, or tell you a little bit about like what I do around that.
All right, hold on. Acupuncture. I'm fascinated with it because I see a lot of benefit when it comes to acupuncture. I've had one on before, and he's talking about a lot of ways that it helps kind of fix your muscles a little bit in general. But I am afraid of it because of Final Destination.
Because of the needles, or
Yeah, the dude that fell off the table with all the needles in him, I was like, all right, yeah, I'm good. I don't need that in my life.
yeah, yeah, the needles are real thin. I mean, some people that helps, some people they still don't care because they just hear needles. I think if I see someone with a lot of tattoos, which there's a lot of people out there with tattoos, it's like the needles are pretty thin, and usually I use anywhere from like eight or more needles in different areas, and I'll tell you, I've treated kids and I've treated adults, and most of the time, like probably like 8 or 9 times out of 10, when someone's like really nervous, I just do a really gentle technique, and they don't even feel them going in.
Yeah, I feel like it's all about a soothing technique too. Like when you're even putting needles into somebody, you're attacking what, their muscle groups or their pressures, or I guess their nervous system.
Yeah, kind of everything. But yeah, usually it's going into a muscle or near a tendon, or it's near a pathway of a nerve, and yeah, typically I'm just treating what after I do an assessment, I just treat the systems that are stressed, and then they just kind of rest on the.
Well, I mean, even people consider acupuncture a bit of a pseudoscience too, mostly because a lot of people don't believe that needles can actually fix you. But what have you seen that's really kind of been beneficial, just or shown change into someone's life that might be struggling with something? Because I've heard of things like people dealing with like fibromyalgia, or they're dealing with something insane, like a weird medical, like it's just system gone wrong, but they're able to fix it.
Yeah. Um, yeah, I mean, I've seen things from different types of pain to someone that couldn't get pregnant. Uh, I treat a lot of people that have going through cancer treatment. So, I mean, not necessarily treating the cancer, but usually if they have pain, numbness, nausea, do the treatment and they feel a lot better. And they're doing everything to mitigate the side effects, and nothing's helping. And they have a few acupuncture treatments, and then they're feeling better. See people with like digestive issues, from like irritable bowel to
Well,
food out.
how do you fix irritable bowel with needles? I don't understand unless you're doing like surgery or something. Like it feels really weird because like for me, I'm dealing with a irritable bowel kind of gastrointestinal thing going on right now. So I'm wondering like how is acupuncture going to help me with it?
Yeah, so it's a holistic approach. So it's not just acupuncture is just like one component of it, of the treatment, but you know, it would basically figure out if you have any food sensitivities or food allergies, which we can do without testing. Typically, it's just more or less of doing a food challenge where you take out, you know, the top six food allergies out of your diet for 2 weeks, and then you just kind of start reintroducing them one at a time. And then if you have, you know, an obvious symptom like digestion wise, or some kind of respiratory symptom like a, you know, runny nose, coughing, you know, start getting bloated, gas, then that is a possible trigger. So then we just take that out of your diet, and then so that's more on the food realm. And then, you know, I would see like what other systems are really stressed. You know, if your sleep's really low quality, uh, we look at ways of improving that. So, and then we, you know, there's treatments that basically work specifically on the digestive system. So it just helps with like any inflammation, but like in the digestive system. But if you're, like I was saying before, if you're, you know, if you're putting something in your body that your immune system or your digestion just can't process, then it's just going to go, you know, go through you or create a big inflammation party. So we just try to stop the inflammation party and then do things to help improve the stomach and digestion. So usually like someone will have, you know, with like irritable bowel, we'll see like, you know, uh, the whole abdominal, all the abdominal muscles, and you know, get really congested, and they'll either be tight and locked up, or your abdomen will be really cold because the things are just really constricted. So once we can take out that the food that's causing the trigger, then we can kind of unwind everything, and then, you know, most of the time, you know, it's back to normal.
Just from talking to so many doctors and first of all experiencing something myself going on with me at the moment, I've decided to research so much into just the body in general and try and find ways of how people are dealing with certain things. I've heard motivational speakers that talk about just the average being weighted down by doing a lot of chores around the house as like a housewife or something, and you know, taking care of kids, running down constantly, especially working at a bakery for 20 something years. On top of that, all the constant bending down, she ended up pinching one of her intestines, and it ended up closing off to the point where she wasn't going to the bathroom. I'm hearing stories like that and how she fixed it doing chiropractors, just being able to bend the back. I mean, there's so many things people don't really realize how sensitive we are. Like being able to use acupuncture to fix a certain muscle group better with stimulation wise is the same thing. Like I'm a weightlifter. I like to lift weights. My muscles get tense. What's the best way to calm those nerves or make sure those nerves get released? It's either the cold or basically a massage or electrical impulses, but also acupuncture is a major benefit here. So many people that deal with Parkinson's turn to something like this to be able to help make sure they don't shake their hands anymore.
Yeah, yeah, very true. Yeah, the and I think like one, because I hear what you said earlier all the time, like, you know, people don't understand it or believe in it or whatever. But if we just kind of get outside of what we do in the US, or even what we do in the US, United States, like, you know, they acupuncture is used like all over the world. There's, you know, and then even in the US, we have, you know, even though I'll hear that from other medical providers, but at the same time, there are almost every medical field is either had added or is trying to add acupuncture into their scope of practice. So I don't really buy that people don't believe in it. I think they may not buy the I guess the philosophy behind the history of it, because they just don't understand it. But it's just a different jargon. It's like every profession, they got their jargon. If you don't know the jargon, then you're like, oh, that's total BS.
I think in society, we're moving up into ways of really kind of understanding it more and being more open to new things now that we're seeing a bunch of crazy things get done, such as like miracles or, you know, somebody being able to have a kid after going through acupuncture or something. But back in the day, the simple thing was you need to go to the doctor. He's going to prescribe you something. Either they're going to cut it off or they're going to go. You know what I mean? That whole thing. And now we're coming into this mindset where we're seeing so much when it comes to like holistic healing. We're seeing a bunch of things with like Reiki energy healing becoming super popular now. People starting to believe in this type of thing. I mean, I try and stay open minded with everything. I'm willing to give everything an experience or a try, but I will probably never do a chiropractor only because I have a weird thing when it comes to my back that just really freaks me out. And I think it all comes to an understanding. But when we look at so many different countries, civilizations, other societies, and historical things that have been using remedies such as herbal teas or meditation, yoga that are now becoming over here, it's all happening to do a lot more with the amount of immigration and travel people are experiencing now. I mean, it's easy for someone to just be like, I'm going to go travel and then go travel somewhere. You know what I mean? Even though we're dealing with like a virus infection at the moment from different countries, but you're hearing more people go over to these distant lands where a lot of this is very popular and they're starting to bring that culture back home. And that's why I think it's becoming so popular because here in America, our simple fix for everything and what we adopted in our culture was take a fucking pill and let's see how better you get. I mean, I have insomnia
Right.
and I went to my doctor. You know what he told me? He gave me a prescription for Valium, or not Valium, Xanax. He gave me a Xanax prescription for insomnia. I'm like, is that the first thing? Like, there's nothing else we could do. Maybe a form of meditation, maybe a form of relaxation or something. I have no clue. But really?
Right, right. Maybe ask you like how much caffeine do you like drink a day, or hey, right before you go to bed, are you gaming? Maybe spend 2 hours just kind of chilling, writing, unwinding, because these
I can
are
spend 6 hours staring at my ceiling and nothing will happen. No phone, just complete darkness. The weird thing is my body's serotonin levels are extremely low for a person, which means my body just, I
yeah,
guess, has a natural slow production of it. Because I do have ADHD, which is like caffeine. I could, I
yeah,
could, I could take 4 shots of espresso coffee and go right to bed. I mean, I've drinking a pot before and gone to bed. It's never really played an effect on me, but it always explains something in my mind that people are completely different. So when I hear these stories of people that are like, "Oh, my liver disease was cured after a chiropractic thing," or I can believe it. I can be open to it because I understand people are all completely different, whether it's their genetics or whether it's their nutrition, whether it's how their body is.
yeah. I have just coming back a little bit with the IBS. Like I have this digestive breathing exercise that I have on YouTube. I think if you just YouTube search my name and digestive exercise, it's real simple. You're basically just doing some breathing, mindful breathing techniques, and you're doing some really light massage on your abdomen, but and then you basically end with like a either a short or long meditation. This depends what you want. But I've had so many people like we do some of the food challenging and the acupuncture, and it's like helping, but it still comes back, and then they do this daily practice because it's like you were saying earlier, like everyone's wired differently, so what works for one person may not work for another. But it's just some people just hold stress in their digestive system, so it's just kind of a way to relax it, calm it down, and then the next day you do it every day. It just helps reprogram it. I kind of think of it like, yeah, you're just kind of rewiring your clearing out your stress, but you're just doing it yourself.
Well, I mean, we've experienced micro fractures, is what I call them on a daily basis. All the stress, whether it's, not having enough money for this or missing an appointment on that or being late by 5 minutes or not having your coffee or not having your shoes tied tight enough or not having the right socks on. These are all things that pile up into your day. And at the end, we don't address them as people, where a lot of doctors will say, you hold a lot of tension right here. It's like, yeah, because I'm not fucking releasing it, like nobody's going to go home and roll themselves all over a yoga mat. At least the average American is not going to do that. Mostly it's like, I just want to sit down and lie down or something and rest. But all these people that are going on these yoga adventures and trying to show these forms of meditation, I think they have a very, very positive outlook, but I think they do get a bad stigmatized view in the way social media is, because everything that they're doing is like one-handed poses and stuff that involves like really kind of old badass methods, I would say. But
Yeah,
for the average person that has like a backache or something, like I can't fucking do a one hand pose. What the hell? Like, it's that whole thing. It's not easy for them. I think there needs to be a way where we should start showing it in a more open manner, such as like just lie on the ground. You don't need a yoga mat. Just lie on the ground and really kind of just stretch your limbs out like a starfish. Let's see where that goes.
Yeah. Yeah, I think, I've found that the simplest exercises or breathing exercises work the best, but maybe when people see it like on a video, it looks so boring and simple that they don't get maybe a large following, but if they were to do it, it would probably work much better than thinking they can even try it because they can't do a one-handed pose or do some kind of like radical back bends and all that. I think there's this one uh routine that you just like lay on your back and you just rest your legs like on the couch so they're roughly perpendicular to the floor, and you just kind of bring your arms out, and then man, it feels so good. You just kind of relax and breathe, and it just kind of aligns your tension. But I mean, I could you could show somebody that in a 10-second video, and it would work really good for a lot of people.
Well, our ways shifted in seeing videos like that. We went from being like, oh, that's like, remember when we were kids or something, the whole thing when school was like, when you get upset, take deep breaths, just breathe, just breathe. Or there was a thing when my teachers used to do, like, everybody just take 5 inhales, 5 exhales, nice and slow. Like that used to be a thing. Now it's like, look at that kid inhaling and exhaling. What a weirdo. Like that's the whole mindset we have now as people. You see a video of someone doing, you're going to breathe in like this and then hold it out. And the only time you ever really truly take those serious is when you've dealt with something yourself that's caused you to really kind of believe or turn to any type of advice to help you out, or you're in that state at the moment. Like there's videos out there about deep breathing exercise to help anxiety, to help stress. There's videos out there that can help you solve your constipation.
Right.
Okay. Like they have this thing now, binaural beats, like using these type of beats and methods that go into this combination on a different frequency where it's supposed to take your mind completely off track. Because like people with an overactive imagination, that causes complete stress. I mean, I'm an insomniac with ADHD. That's like tossing fireworks into a toilet. Like it's nothing but ideas. My mind's running constantly. I mean, it's good to have a conversation with, but I always need to be doing something. So when I'm not talking, I'm in my thoughts. And when I'm in my thoughts build up and it becomes a lot too much sometimes. But you experience things. This is why people need to find an outlet, need to find a stress relief and find that piece of meditation.
Yeah, I mean, I think the always whenever I'm showing somebody a new routine, and they always ask me, "Well, how long should I do it? How long?" And when I always learn stuff, they would always give me like, "You need to do this for like 1 hour or 30 minutes or whatever." So I think again, it's like everyone's different. So I mean, you may just need a 5 minute routine, because if you are like trying to force or push yourself to do half an hour, and you're just like, it's just going to make you more stressed. So I always just say, sometimes you can just, you find the right routine, you're going to do it for a couple minutes, and that this may help reset you enough to move forward with your day, or clear out the stress. It doesn't have to be, you don't have to be on the mountaintop somewhere with no one around you and be up there for 3 days to clear stress. You could do it 5 minutes in your living room, and then you're done. So I think it's there's really no dogma to it. You could just
Well, people always talk about what like the gym is their stress relief. That's what it is for me, but you can find that anywhere. Surfers talk about being in the water or sense of relaxation. I know after a really long, stressful day or something, if I take a shower, I feel completely renewed. I mean, refreshed, you know. There are so many different forms. I think it's the true answer is to find what fits you the best, find what fits you the most, find what's going to be your access to a whole new existence, an overall self reset. And if that's doing yoga on the beach, if you like doing it, then so what other people think? We live in a world where everyone constantly likes to a little bit judge and make decisions on people. It's like, let's just let someone do what they want to do. Like, it starts at a young age, obviously, but there's a child mentality we need to go back to where it's like, let's just have fun on the playground and see where it goes.
Yeah, definitely. Yeah, I'm. They have sort of on the exercise front. I've really enjoyed doing this one routine. It's called Move Naturally, or they have like you exercise, but you're pretty much like in nature. You're just climbing trees, and but basically like just what you said, like just being more playful. But then when you're being more playful and you're moving in a very dynamic way, it's really strengthening to your nervous system, your body, and it's very toning, and it's just kind of a different way to work out. And it's very easy to have that untrained, if you sit for long periods of time at work, or bending over and not really being conscious of your core or your back. Yeah, it's very easy to get something knotted up or injure your back, or just kind of lock something up. And then but I really like some of those routines. They're just super simple. You're just kind of unwinding your body, and then yeah, everything just kind of resets.
I do have to ask though, because with acupuncture, there's something really, really popular that I've kind of been curious about. Cupping.
Oh yeah.
What is that? Just bringing all the toxins to the surface? What is it?
Yeah, basically. I really like doing fire cupping. I think maybe I have like a my inner child just like seeing the fire. But basically they have different types of cups. They have cups that has like a valve, and you basically pump the air out of the cup, creates a suction. The fire cupping is you basically use a glass cup, and you basically light a cotton ball on fire that has typically 90% alcohol on it, and then it basically just burns the oxygen out of cup, creates a vacuum. And then yeah, we use it for all. I do a lot of cupping in my practice. I just really grown to enjoy it, and the patients really like it. But yeah, it basically brings blood up to the surface. So if there's like tension, or the muscles are really tight, it helps release tension. And then I'll even do it for um, different, if there's different say like organ systems that are really stressed. If I do it in the zones on the back that are related to that system, that will basically help relieve stress in that system too. But yeah, it could bring up toxins, or vent out toxins.
It looks painful as hell. I gotta admit, when I see those giant red bubbles start popping up, I'm like, that does not look good. That looks like a tumor, and I'm scared.
Uh-huh. I well, there's different coupling approaches. So there's one where it's just more stationary cupping, and you leave them on for a while, and then yeah, it could create like really dark uh bruising, like tissue, and it could also create like little blisters if you leave them on too long. But I typically do what's this called flash cupping, and then you basically just kind of put it on and take it off on different areas of the body. And then it's very interesting because you'll see, based on like the color of the skin and the tissue, if an area is really congested. I mean, sometimes you can see it. You can see like say one muscle area is like super contracted compared to the other side. Um, but then sometimes there'll be areas that are just really locked up, even if it's like deeper than the muscle, and it will become like discolored, like it'll get blue or purple. And when that happens, it creates like a whole like immune reaction, because basically your body goes into that area to clear up the bruise and heal it. So you get that constant like stimulation to that area. But I think I've had one person in the years I've been practicing that just found that their skin was just so sensitive they couldn't tolerate it. But most people love it. I've even had people that they hate massage for some reason, but they like the cupping because they get the tension release without feeling uncomfortable with the the physical touch of a massage.
That's a lot of people nowadays too. Like me, I'm not exactly a hands-on type of guy. I can do a hands-on like when it comes to a job or something, but when it comes to like Reiki energy healing, it's always been something difficult for me. My mom's a Reiki master healer, I guess, whatever term you would say. It's just not for me, I think. It's the type of when it comes to holistic healing in general, not when it's just on the basis of nutrition, but when it comes to forms of meditation, comes to things of acupuncture, comes to thing of chiropractors, you have to be very open to it. You have to believe it. You know what I mean? It's the same thing with Reiki energy healing. If you're not open, you're not believing into it, it's not going to work, because a lot of it is a both people have to work here. It's not like a medication, it's not like a pill where you can take it, you don't have a choice.
Right. Yeah, I mean, it definitely helps if they're open to it. I mean, I've seen it work when they didn't understand it. I mean, no one, I mean, most people don't know how electricity works and how to turn on a light, but they hit the switch and it turns on. So I think it's just, I think it's just maybe how, when if someone's like brand new to any type of holistic healing, like how they understand like how it works, right? So
So what exactly are you the most passionate about out of all the things you do? Seems like acupuncture is something, but it's not the top priority here.
I think just really understanding what is the root of the issue, because if you can figure that out, then everything else unravels. So a good example would be someone has. Or I a great example. I had recently had a patient. She had a lot of shoulder pain, mostly in the front of the shoulder, and she had massage and physical therapy and chiropractic, and then they all helped, but it was all temporary. And then she told me how she had her father passed away, and so she, like any of us, she was grieving, right? So the area that the pain was at was related to her grief. Typically the area of the lung connects to grief. So so basically I just did some treatment to focus on the lungs and a grief, just to help her. It's not going to make the grief go away, but it just help process it better. And then her shoulder pain just cleared out. So I think it's just really listening to what's going on with someone, and
Like
so
trying to solve somebody like a puzzle piece, basically. Like you're putting them together. I mean, we look at like looking at someone, let's say they have a broken arm or something. It's obviously you're gonna put it in a cast, you're gonna do all these types of things, reset it, whatever you have to do, make sure it grows
yeah,
properly back. But when you're dealing especially with internal issues as well, someone's dealing with
yeah,
a nerve issue, it could be similar to like if you look up any type of thing like I'm having a weird clicking in my knee. What is that? Oh, it could be cancer. It's like, what? What do you mean it could be cancer? Then it gives you like 12 other things that it could be. It's like, which one is it though? You just want to know. WebMD is the easiest thing for people to look up, or whatever the hell it is. Just to be able to look up like, oh, this is happening to me. I don't want to go to a doctor. Is this serious? And should I go? It's like, if you're asking if it's serious, you should probably go get it checked out.
right, yeah. So I like the way you said that. Just like it's like a puzzle. So I think that's the fun part. I think it's getting to know someone and then figuring out like what piece needs to be adjusted, and then but I mean I figure that out, and then sometimes I can figure it out right away. Sometimes it takes a little time because maybe I'm not it's not being communicated. I have different ways of doing assessments, so that helps me uncover what's going on, even if they're not telling me. I can see it or feel it. So we typically do sort of the what I call it, like kind of traditional assessments for someone that practices Eastern medicine or acupuncture, is to do a tongue and pulse assessment, and then that kind of unravels a lot of what is happening and where the stress is. Even if like so, I've done health fairs and screenings where I just look at someone's tongue and then they don't tell me anything, and then I tell them like what I'm seeing on their tongue, and then it just sort of gives me you know insight. And of course sometimes it's just people just telling me, oh yeah, my father passed away, and then I'm like, oh my god, it's totally connected to your shoulder pain, especially since they had imaging, they did all the physical treatments that you can do. So then it's it's like it's more of an emotional reason why they have the pain. So I think it's just kind of that's the fun part for me is this getting to know someone and just figuring out what the root issue is.
Yeah, I feel like a lot of doctors are starting to get hip to this new thing called the brain and gut connection. Um,
Oh yeah.
it seems like we've been for so long when something starts hurting, it's been diagnosed as this thing as like, oh, it could be this, it could be that, it could be this disease, could be that disease, could be this be infection, could be that, could be this. It's like, did we ever start looking at people like why therapists are becoming so popular now and people are starting to turn to this form? It's because for so long we've been living as people as this disconnected version of ourselves. I mean, we used to be so connected. We used to have dinners every night together with our families. It's just not happening anymore. We're living in an age now where social media is the way we interact, and that interaction is false connectivity. You know, I've talked about this for so long, and it's like no wonder people are starting to come out with like I swear, ever since I started experiencing some stomach issues, every I've been hearing everything from people like, "Oh, I had this thing in my gut disease or something." I'm like, "What is happening?" Like is it all we're all starting to get a lot of stress and it's all building up to where people are getting sick left and right like it is a coronavirus? Like I feel like we're all displaying this negative energy around us and we internalize it as well, and it's like this has got to be connected. Like why let's have a conversation and see what like you can feel so relieved after a conversation like someone just slipped you a Xanax.
Yeah, for sure. Yeah, I see that too. The sort of I just one of the reasons why I moved to Florida is I have family down here, and I pretty much lived in areas for quite a while, not living near family. So it's completely different exchange when you're texting or you know doing a post to a friend or family member. But like you said, you sit down and have dinner with them, have a face to face conversation. Like you literally can feel you feel better. You feel and it's an actual you know connection versus like I mean maybe it can help some people. They have a text conversation or someone likes their post and then they feel you know heard and then but yeah, I think it's way deeper when it's in person and you have that you know eye to eye contact and
Well, it's the same thing when you get into a conversation too. A lot of times, like you can run into someone that has a draining personality or something that has like a wet towel personality, where afterwards you're just like, "Fuck!" Like I'm so drained. It's so hard to be able to keep it going a lot of times, and it's like it's so easy to spark up creativity. I mean, it does get difficult, but when both parties aren't truly paying attention, you start to notice it through a conversation. It's really I think a lot of doctors really need to just spend more time with their patients. I get how difficult it's got to be on the consistency of how many patients they probably experience, but there's just a giant disconnect when it comes to the medical industry. It's just so easy to write off a prescription and get the paycheck and go home.
yeah. And then there's other aspects too, and I agree with what you're saying, but also the way the structure is with the insurance companies. They it's great, you have some coverage covers your care, but then there's always requirements for the practitioner. They may only get paid a certain amount, and that's always changing every year. So then they have to to cover their overhead and their expenses, they have to this new volume. Their volume needs change.
Well, they have the nurse even that comes in. Like the nurse is the one that gets to know you the most. I feel like every time I'll wait 45 minutes for my doctor and I'll only get 10 minutes with him. It's like let's talk. Let's get down to the basis of what's going on and try and solve it before you throw me into an MRI or throw me into a bunch of blood work trying to get an answer that's not going to show up because it's something completely different.
Yeah, yeah, it's unfortunate, but I think a lot of people in healthcare, they feel very I would say almost trapped because they're in the field. They most of them I would assume enjoy what they're doing, but then when they get to the the numbers piece, or if they work for a group and they're like all right, we'll pay you this is your base pay, and then if you want to make you know more, which everyone's going to need to because they make the base pay real low. That like you need to see X amount of patients, or you have to see X amount of patients, or you're not going to be able to make a living.
You see what I mean about two people being involved in a conversation, man?
Yeah,
Background noise though, but being connected, you got to like, you know, I could sit here and ask you questions all day, but we're not truly going to get to anything if you're not truly getting involved.
right. Yeah, you're right. Yeah, and actually, like in the long run, it's going to save time and money if they just sit down and get to know the person and what's going on with their lives. Because they're like, oh, I feel depressed. Okay, here's a medication. Bye. Or and then instead of like, well, what's going on? And then it only, I mean, in actuality, it only takes a little bit longer to find out what's going on. But like, the volume of what they're supposed to see a day is trumping the
Well, I think that's just because the old school mentality of being a nurse or being a care provider, or all these old school notions that used to be the norm. I mean, when you grew up, it was be a nurse, be a doctor, be an astronaut, be whatever. It's be something accomplishable. It's going to make a lot of money, make that big fat paper, that cheddar. And now we're living in a world where it's like I can leave my job right now and start up a gaming company, or play a game of Fortnite and win a tournament and win a couple $1,000s. And the world is not ready for that, because now, we're living in a society that's running by old notions, but we're living in a world and with people that are wanting to change to the new forms. It's amazing, but it's a pull and push scenario here. If just the world doesn't change from these factory settings of breeding people that work a 9 to 5 lifestyle. We got people that are popping up doing amazing things just overnight, starting up a company, starting up their own coffee, hot sauce, whatever, just creating their own product, because it's there. That information is there. Technology has gave you that power to be able to order anything you want with Amazon, be able to get any supplies to your doorstep, be as creative as you want to be. And the world wasn't ready for that. Everybody back in the day was like, I'm going to be a doctor, I'm going to do this. And by the time, like, I was told in 2019, by the time it hits 2020, that there's going to be the most out of work nurses and doctors, because of the fact of the generation that was instilled into becoming those is going to retire. They're going to leave. They're at that age now. And it is true. Every time I walk into a hospital now, I'm seeing nothing but young people. I'm like, what's happening here? Like,
yeah.
it's where's the older people? And sadly, a lot of older people that go to a hospital are not going to trust a dude in their 20s. They're going to look at him and be like, let me get a better doctor who's been here long enough and done at least 200 something surgeries or something. It's like, that doesn't mean anything. Something could randomly happen.
Yeah, we definitely see that in our field. The doctors they're retiring earlier, or like the baby boomers. There's just a lot of them retiring, and you have like a whole new wave of practitioners. And I'm probably biased because I'm not a millennial, but I hear a lot of people like middle age and older that they complain that the communication skills are just not the same as they're used to with their I guess with their peers, that you know they speak and communicate the same way. They're not as they can go on Facebook and do their posts, but they're probably not on their computer all the time. But I'm even seeing that change. Like I see I'm visiting with my mom. She's in her mid 60s, and she's always. I mean, she pretty much is on her iPad or her phone like all the time. So I think it's even affecting that generation. They're slowly getting accustomed to that, and it's probably altering how everyone's communicating as well.
Would you say the technology really isn't bad, but it's the fact of where we're taking it? Seems like there are some positives to how we take it, but a lot of us are just being very selfish with it as well. Instead of looking up forms of meditation, it's much easier to write a hateful tweet at somebody. Being able to scream or make a Facebook post complaining about something is super easy compared to being able to donate money or being able to start up a business or something that might help some people.
Oh yeah, for sure. I think there's definitely more productive ways to channel that if someone's feeling lonely or not heard, and they just kind of vent. I definitely have some friends that I just stopped I just stopped following because, like, they every post was super negative, and you feel for them, but then it's just kind of not very productive, and it's just
Well,
sort of a
it's
rant.
the same reason motivational speakers are so popular nowadays. There's literally a hashtag motivation that's got like 55 million posts in it, and it's just people looking for inspiration, looking for motivation. I'm like, why don't you just do it yourself? I mean, all day, the reason why people stop following people on Instagram or doing something like this is because it's either complaining or doing something the same. And it's like liking it's not going to help them. Being sorry for them is not going to help them. Half the time, it's just an attention seeking thing. I mean, it's true. And yeah, I understand if you're going through some stuff, but you're going to keep going through stuff because no complaining about it is not going to change it. You got to do something about it that's going to force that change. But we're so comfortable with somebody prescribing something or something doing something for us where it's going to solve everything and we're going to be cured. We can go back to the way we're doing it before. It's like, no, you got to make a change. You know, we fight this vegan movement, which I think is completely wrong, mostly because everybody that's vegan wants to keep promoting that they're vegan. I don't care what you eat. I don't care what works for your body, but it's the same thing. Not everybody can be vegan. Some people know they need meat. Some people need this. Some people can't focus off of plant-based diets. Some people can't eat fish. Some people, that's just what happens. People's bodies react differently. What works for you, be more than happy then. But I see all these hate messages on Instagram when it comes to groups, so many things that solidify into like hashtag women's rights, hashtag vegan movement, hashtag cats only, hashtag males only. I'm like, what are we doing? We lost the original hashtag, which should be people only. We should all be people lovers rather than sided. We want to be connected, but we're being completely divided with the power of our connectivity.
Yeah, I think, yeah, I see that as well. And there, I had I shared a post. There's a small team of engineers that they created this glove that when you did sign language, it would voice the words, so someone could, if they didn't know sign language, could understand. And then, the website was promoting African American professionals. So it literally said two black engineers, created this glove, and I was like, oh, that's awesome. So I just reposted it because I thought it was a really good invention. My mom's hearing impaired. I thought it was really cool, and then but I did think, oh, I bet someone's going to say something about uh white or black, or why not just two engineers. But I was just sharing the post. I didn't say, look at these two black geniuses that created this thing. But then it just created a whole another channel of, like, exclusion. And but it was really about the post was mostly about this invention. Two smart people came up with this invention. I don't care what color they are, but the website was basically promoting African American uh, professionals. But yeah, it's just kind of interesting. I guess you can twist anything
Well,
into.
it's a fact that we live where everybody's been suppressed. Certain people that are breaking out now that are starting like feminist movements, they've been suppressed for a while. I get it, but holding that tension and holding that aggression isn't going to solve anything. And I know that's just coming from a young man's perspective as well. But it's like, let's move forward, because if we keep just acting the same way, it's just going to spread like a virus to all the younger generations, and it's just going to keep getting worse, and we're going to end up being completely divided. It's like, let's just start. When I walk into a store, I treat everybody equal. It's like, you treat me with respect, I'll treat you with respect back. And not being able to have a conversation with someone, not being able to get to know somebody, it's all creating this displayed version of the world. We talk about how the climate's changing and how the world's getting worse and different health effects playing on people. Well, our negativity is creating an infective world too. It's starting to create people that really don't want to talk to anybody. It's starting to neglect a lot of things about themselves, neglect things about others. Have this, you live in hate all the time. You're going to end up being in pain. You're going to end up, needing something to talk to, needing a therapist. That's why so many of them are making so much bank right now, is because there's a lot of people needing a therapist. It's like, you don't really need a therapist. You just need someone to hear you out for once, whether it's a family member, whether it's a pillow. Just have that connection, and you might see something spark up again.
Yeah, I know there's a definitely a channel for like every possible need, or every group. I mean, back over we're talking about healthcare. We even do it in different industries. You have like the chiropractors, and then I mean, it's like any profession. There's good ones, there's bad ones, and then there's some that think their profession can treat everything, and then and then we have like the holistic. It's like, oh, holistic, it's better. It treats everything, but it's all about integration. It's like it's all healthcare. It's we can call it a different title, and you have a different degree or a different license, but I mean, everyone is just trying to help one another get through what they're getting through, and depending, I guess, on the belief system of what's a better doctor, like you're saying, like age, like there's always I always remember this funny story about there's it was a kind of an older Asian community and in China, and this one young doctor got really mad because no one wanted to see him because he was a new doctor. So he got this idea that he was going to dress up like an old doctor. So I don't know, I guess he shaved some of his hair and like made it look gray, and he grew out like a mustache and beard. So he looked like, the old wise doctor. And then I don't know how long he went on to practice, and then they finally realized that, he was young. So it's just, that can be deceiving. Looks can be deceiving. So some people think that because someone's age, they can't be as good as the old wise Mr. Miyagi. But there's some really sharp, wise young people out there too that could do just as good. So it's kind of funny.
What would you exactly suggest would be a change for people?
As far as mindset when looking for somebody to help them, or what do you mean?
Like, how do you expect the world to change? Like, what would you suggest? Like, for me would be to connect with people again, but from a doctor's perspective, and being able to treat somebody, especially with holistic ways as well. What would you suggest?
Yeah, I think just getting more in tune with yourself, and I mean, I'm usually more of an advocate of connecting with your friends, your family, your community, uh, and then just understanding yourself. It's like, and some people they need a pill for their blood pressure, but other people, like, they could change their diet and exercise and just kind of get into like what's making themselves feel better, be better, live a higher quality of life. I mean, I think you know I guess there's different mindsets. Some people believe we're here to suffer through life and learn lessons, and then other people believe that we're supposed to make this life you know uh, you know uh, an awesome experience, or some people call it like a heaven on earth. So I think we ultimately determine our own experience. Like, we're responsible for how we feel, how we think. We're the only ones that can control that. I mean, it's so I think just kind of getting more accountable for that. I mean, definitely there's circumstances that come up that we can't control, but
I think
we can control.
life is literally like a journey. You want to sip it like a fine wine and not do it like a shot. We rush things way too fast. Either you live from 1 to 20, you live 1 to 99. You got a short or a long time depending on how you take it. You could be the safest person in the world and live to be 20 years old. You could be the most dangerous person in the world and live to 90. I think we all have a time, we all have an expiration date, and it depends on the person too. Even the idea I heard at one point, like people say, I think cancer is inside of us all, but I believe it manifests in some people and then for some people it doesn't. That could be true because I've seen the nicest people die at the youngest age, and I've seen the oldest and meanest people that I've ever met. It's back and forth on both sides of the spectrum. I think it's this journey. It's like a roll of the dice, man. It's a gambling event, and you never know what it's truly going to become. But I think if you're doing everything in your power, every step forward to really get to your goals and get what you feel accomplished, no matter what people say, as long as you're not hurting anybody, I think you're doing the right thing.
Yeah, for sure. Yeah, I think just having a kind of a clean approach to it, just be able to follow your passions, your heart, and you know, and just supporting one another. We have had I've been on on the social media front. There's they have different groups for every profession, right? So we have happens all the time. Like someone will be like a new grad, or they've been practicing for a while, and they'll just ask a very genuine question, and someone will just like, instead of like trying to help them or not respond at all, they will literally just blast them and just give them a whole bunch of shit and make them feel stupid or whatever. And it's like, what is the point of all that? Like, why some people feel the need to be on that attacking, there was one to attack somebody, but clearly it's what's going on inside them. They're unhappy, and they're just looking for someone to project that anger or their own frustration on. So it just kind of comes out in weird ways like that.
Yeah, I agree. I think people just need to change a little bit too. And I appreciate you coming out and doing the podcast, man, and giving me the time too. I really want to give you here a minute at the end to kind of promote your content so people can find your work.
Oh yeah. So I actually, like I said, I relocated to basically the Tampa Bay area. I still have my website active from the West Coast, but it's just www.drfredrusso.com. And then I have some information on YouTube too. So feel free to check it out, and reach out to me if you have any questions or want to have a conversation.
Well, thanks so much for listening to this episode of Out of the Blank podcast, and stay tuned for our next episode.